Type 2 diabetes is a condition characterized by elevated blood sugar levels. In Belgium alone, more than 600,000 people are currently affected by the disease, a number that will rise up to 1 million by 2030. Strikingly, 1/3 of the current diabetes population is still undiagnosed. Type 2 diabetes occurs when the pancreas doesn't produce enough insulin, or when the organs become insensitive for insulin. Diabetes is linked to various long-term complications, which are divided into microvascular and macrovascular complications. Microvascular complications caused by damage to small blood vessels include diabetic retinopathy, autonomic neuropathy, and diabetic nephropathy. Up to 50% of type 2 diabetes patients will develop kidney disease. Macrovascular complications caused by damage to larger blood vessels include stroke and heart attack. Diabetes increases the risk of stroke and heart conditions by 2 to 4 times. Worldwide, one person dies of diabetes-related complications every 6 seconds. Diabetes therapies seek to prevent these complications to improve life expectancy and quality. An adequate glucose control is essential for the prevention of micro and macrovascular complications. Despite this, a majority of the patients do not reach their target values. Earlier and more intensive treatments are required to help more patients reach this target and decrease the development of micro and macrovascular complications. Despite advances in care, cardiovascular disease is still the most common cause of death in adults with type 2 diabetes. Uncontrolled diabetes, and more specifically, the high concentration of glucose and insulin, have a negative influence on the proper functioning of the small and large blood vessels. Furthermore, the risk of dying from heart disease doubles or even quadruples in patients with type 2 diabetes. Boehringer Ingelheim is committed to finding new, innovative approaches to help patients control their diabetes and reduce the risk of long-term complications.